BCS classification is based onto the solubility and permeability of the drug molecules. There are 4 classes: BCS class 1, class 2, class 3 and class 4. The compounds or molecules or drugs belonging to class 1 are highly soluble and highly permeable. BCS 2 drugs are less soluble or low soluble but high permeable. BCS class 3 drug substances are highly soluble but low permeable, and BCS 4 class drugs are low soluble and low permeable. Out of these 4 classes, there is a subdivision of BCS class 2 also, and we should know what is the subclass of BCS class 2. BCS class 2 drugs are subdivided into 3 classes: BCS class 2A, 2B and 2C. So these classification are done considering the acidic, basic or neutral nature of these drug molecules. BCS class 2 is a class of drugs in which there is a dissolution limited absorption. So dissolution is very important. BCS class 2 drugs are having low solubility but high permeability. Absorption of these BCS class 2 drugs is limited by the dissolution rate of the drug. Subclassification of BCS class 2: BCS class 2A, 2B and 2C. 2A drugs are acidic, 2B drugs are weakly basic in nature, and 2C drugs are neutral or non-ionizable. BCS class 2A, these are the acidic drugs. These are weakly acidic drugs. Dissolution is pH dependent and usually poor in the acidic environment of the stomach, but better in the higher pH of the small intestine. So always consider that BCS class 2A you can refer as for acidic, and for these drugs dissolution will be better in the basic pH. Example is ketoprofen, ibuprofen. See, all these drugs are BCS class 2, but if you check their nature, then you will know how to categorize these drugs. So the acidic drugs or weakly acidic drugs will come into BCS class 2A category. BCS class 2B, these are weakly basic drugs. Then these drugs dissolve well in the acidic pH of the stomach but may precipitate as they move from the higher pH of the intestine. That's why there is a limitation of the absorption. Example is ketoconazole, itraconazole. BCS class 2C drugs, these are neutral or non-ionizable drugs. These are non-ionizable, these are neutral drugs. Poor solubility across the entire pH range of the GI tract. Example is graciofulvin and fenofibrate. So you can check the acidic or basic or neutral nature of the drug molecules belonging to BCS class 2A, and then you can go ahead for the development. All BCS class 2 drugs have high permeability, but solubility is the limiting factor, and subclasses indicate how solubility varies with the pH. Then also we should consider the way forward to improve their dissolution and improve the solubility. Different approaches are there, like use of micronized APIs, selection of proper PSD of the API, use of the surfactants, use of some manufacturing technologies, doing the solid dispersion, improving the solubility by use of surfactant wetting agents, and in combination. Many strategies are there. You can go through the playlist. You will get separate video on solubility improvement for the BCS class 2 and 4 drugs. So this was the information regarding BCS class 2 subdivisions into BCS class 2A, 2B and 2C. Thank you for watching the video.